A lot of people won't know what a camelid is, but you certainly do as a veterinarian.
Yes, camelids. Well, there's 4 species of camelids, and of course the most common ones that people will know are llamas and alpacas, because we see them dotted around the countryside these days, and a lot of people say they've had their day. They were a bit of a fad for a while, but nevertheless they're still a very common sight, and I guess it's a nice opportunity to talk about something a little different, and maybe bring into the fold some lifestylers or some people that might have something to do with it, or got a bit of land that are interested in putting some camelids or some alpacas and llamas on that bit of land.
So what should we be looking at? I mean, obviously there's a lot of animal health situations, like castration, for example.
Yes, so they're typically very easy animals to look after, and so they do fit a sort of busy person that wants the pleasure of having a rural environment around them with livestock, and so they're very easy to maintain, but there are some essential things that need to be done. Castration, you just mentioned. Entire males, of course, they can actually end up being quite dangerous, particularly when they develop very strong bonds with human beings. And so these animals, when they lose that kind of fear factor, if you like, they can be very, very aggressive to foreign people or other people entering the environment. They're quite protective, and so castration makes these animals much easier to manage, and also, of course, controlling reproductively, of course, that's the other major benefit. It's rather a simple operation. A lot of people, in alpacas especially, a lot of vets will do it standing, so no sedation or no anaesthesia, just a bit of local anaesthesia. Llamas, I tend to prefer to do them knocked right out. They're a bit more vascular and a bit more of a bigger surgery, but still relatively simple. They do kick harder, and frontwards to the sides and to the back, so you're in a really, really good target zone. And I guess while we're on the subject of male animals, fighting teeth is another peculiarity of llamas in particular. They're very, very sharp, dangerous, dagger-like teeth that angle forward, and they can be very dangerous to people handling, and also other animals around them. They can be used as quite dangerous weapons, and so one of the more common things we do is actually remove or saw off those dagger-like teeth. Often that's done at the same time as we're castrating, of course. But
what about the other teeth? Do they get overgrown?
They can, yeah. The incisors that they use to pick at food. As the animal gets older, they do tend to overgrow, and we end up with these teeth that kind of overshoot the palatal plate, and so they become less effective, and you have these funny looking older camelids with teeth sticking out at all directions. And so it can be quite common maintenance procedure once a year or so, or to check those teeth, especially in older animals, and it's relatively simple to actually grind them back a little bit. It's quite simple. We use an angle grinder, in fact, and just make sure that the teeth are cooled so they don't get too hot with the friction. But we just need to make sure that they're kept back enough so that they don't angle forward, and they're kept in contact with the palatal plate to ensure the animals can eat properly. It makes them look nicer too.
Exactly. In their natural habitat, of course, there's a lot of hill country and rocks and stuff, but you don't get that on the farm, so
no.
Feet.
Yeah, feet, of course, and that's another annual doing. And so often, when I just mentioned checking the teeth and grinding teeth back if they need be, clipping the nails is another important thing, and this can be done as an annual kind of group of procedures, because shearing is another exceptionally important thing that needs to be done each year, particularly in darker animals, and particularly weathered or castrated male animals. They have a peculiarity that they can develop rickets, and a lot of that problem comes from lack of sunlight. And so if they're unshorn, particularly the darker coloured animals, they can get rickets, and they get very, very sick indeed. Virtually zero phosphate levels in their blood, and that's purely from lack of active vitamin D. So annual shearing is
a lack of sunshine on their back.
Exactly, very, very important. And in conjunction with that, we like to recommend that coming into the winter periods around the autumn, that these animals get given a vitamin supplement, which obviously also contains some vitamin D to try and help prevent this problem occurring. But the hallmark is actually shearing and making sure adequate levels of sunlight.
What about vaccinations? Do you need to do anything there?
Well, It's debatable how needy that is, but it seems to be advised, and we certainly advise that clostridial vaccinations, 5-in-1 vaccinations, as we advise with other ruminant species, sheep and cattle, we advise that that's done annually, because there is really no indication that they wouldn't be susceptible to tetanus or a pulpy kidney or these type of things. Generally they're managed on much lower quality feed, so pulpy kidney doesn't seem to be a managerial problem or a disease, but tetanus I guess could be.
What about internal parasites?
Yeah, it's very unusual to find a heavily parasitised camelid, but I have seen them. The ones that I've seen, I do wonder, I think there probably has been an underrunning problem with their immune systems and they have failed to develop good immune response. But again, it's quite good practice to keep a handle on this, and our advice would be at least annually in adult animals just to check some dung samples for parasite load. So do a fecal egg count on even a pooled sample from a number of animals, just to get an idea of what the parasite situation is in that group of animals.
Should I ask you about TB?
TB testing in camelids is a procedure that seems to be done more commonly probably than it needs to be. I guess we don't know a lot about the disease in camelids, but it seems to be a requirement of a lot of issues when we're using or shifting animals from property to property. It's quite a simple procedure. We tend to just do it like we do in deer actually, and do what's called an intradermal test, and usually do that in the neck. So we're just kind of injecting some tuberculin into the skin of the neck and then reading that test a few days later to see if there's a reaction, to see if the animal's got circulating antibody to TB, which would infer that it's been exposed. I don't think I've ever detected a positive yet, but it is something that seems to be done relatively regularly and may need to be contacting vets to enable that test to be done.
What about other simple diseases?
Yeah, they do have peculiarities as animals, and we do see a couple of things much more commonly than we'd think. One of those is pink eye. They're very, very susceptible to pink eye, and I don't think I've ever seen animals get such severe problems and get the problem so easily as I have with alpacas in particular. So pink eye is a really, really common problem that we see. And the other thing that we, in Canterbury, the region that we're in at the moment, we seem to not very commonly see ryegrass staggers, a problem caused through a fungal toxin and dead material in the pasture. Camelids are exceptionally susceptible to ryegrass staggers, and they seem to wobble around and get symptoms of this disease when there's no hide nor hair of it in other species. So a very peculiarity of the animal, that they seem to be very susceptible to that particular fungal toxin that causes ryegrass staggers. So if there's neurological signs around the winter or the summer months where there's lots of dead material in the pasture, then that would be a good reason to start thinking that perhaps this is the problem, rather than jumping to conclusions of back problems or sore backs or spinal issues. Yeah.
Thanks again as always, Nick.